Thank you. Good morning, everyone. Hi. So we have a bit of a time crunch, but I think this has been really, really interesting to really understand. It's almost a peek behind the scenes of some of the content that we consume related to health and other issues. Like you said, my name is Naisola Likimani. I'm with the SheDecides movement, and we're a global movement of politicians, creatives, young people, civil society, and others coming together to create a world where girls and women decide about their bodies and their lives without question. And today is actually She Decides Day. So all over the world, actions are being taken to raise awareness and also to work towards policy change and more resources so that women and girls can enjoy their bodily autonomy. And a lot of those activities are actually in the form of theater and music. There was a festival on Saturday in Uganda, and so it's really wonderful to see the centrality of the arts in terms of health, behavior change, awareness, and more. So we've heard amazing evidence, we've seen content. I think now we would like to open the floor. If you have any questions or comments for all the speakers, we still have Lisa online as well. So the floor is open. Yes, we have one question there.
Thanks. I feel like I'm compelled to tell a story in my question, but I won't. I'm just curious, and it can go to each of you, I think have probably faced this. How do you deal with the issue of censorship, or the sensitivities in the issues that you cover? It could be homosexuality in Uganda or violence against women in India. I don't mean to label them as such, but I think those problems exist everywhere. Thanks.
Okay, I think we'll take a few and then we'll come back to the panel. Any other questions? Yes, we have one down here. Thank you. Thank you as well. Okay.
Thank you. I want to congratulate all the speakers. I really enjoy each one of your presentation. Thank you very much. And my question is first to Christopher. I really resonate with me when you said that being poor is your inability to tell your own story. And that really, I think, is very powerful statement. And I was wondering how you canalize the stories of people in a way that makes sense to us. Like, for example, people in developing countries speaking local languages, not speaking the mainstream languages, living in rural areas, how you canalize the stories of these people that make sense for us to do something about telling the story. Thank you.
Yeah, we have a person down here. This gentleman. Yeah.
Thank you. My question is for everyone. You're doing fantastic work. I just want to know a little bit more about how much you actually engage with the local governments in order to change all of this into policies in those countries for people.
Okay, I think we have time for one more question. Okay. Going once? All right. So over to you. I think there's a question about censorship. Who would like to take a stab at that?
I can talk a little bit about that.
Okay, thanks, Win.
So in MTV Sugar Down South, we had a prevalent storyline. It was part of one of the videos that did play when you saw one of our characters, Reggie, coming out as gay. Now, in South Africa, that was a storyline that we could treat quite openly. But we distribute the show across Africa, and for some territories, it was really difficult. And it was quite difficult for us because we wanted the South African show to reach as many territories as possible. But we knew that it was going to be difficult in some territories. There's a kind of dotted line to your question about talking to governments, because we talk to governments and government departments in every territory. And what we did was we had a Pan-African version of the show where the gay storyline for certain territories was edited. It was really difficult for us. It was something where we really had to look at ourselves and say, How far do we want to compromise our messaging here? We got to a pragmatic position, which was we need to take big steps in some territories and baby steps in others. The truth is, if you have an internet connection, you can watch the uncensored version wherever you are. And that's where we kind of took our solace. And this also is not about standing in judgment around particular cultural norms in specific places. We may have a view, but who are we to impose our worldview anywhere? So that was one specific point. We've also had issues around abortion. And finally, I would just say within a country, within Nigeria, we've had some challenges where in certain territories in the country, certain parts of the broadcast were acceptable and some weren't. And that then came down to a question of distribution. So the main terrestrial broadcaster in Nigeria is NTA, and they have different regional transmissions. And we produced some content for particular territories in the north, which was slightly different to what went out in Lagos. It made things complicated, it made things challenging, it made us sometimes kind of clench our teeth, but at the end of the day, we had to say, what is the most important thing here? The most important thing is to get our key messages out to as wider audience as possible. And sometimes it meant that we had to produce different versions of the show for different places.
I think from a WHO point of view, I would answer the question in two ways on censorship. The first is, we're in a unique position as WHO because we are a health technical agency that is evidence-based. So oftentimes that's a wonderful tool to be able to cut through censorship because we are, and it gets back to this notion of trust. Member states do trust us of any political stripe. So if we can present the evidence, then we have a good fighting chance to actually grapple with the issue. So that's on the positive side. The other thing is, it gets back to why art. I recently have been involved in a series of events and shows around vaccine hesitancy. And one of the things that I've learned on that particular journey is that many of the people who mistrust vaccines are not uninformed. They're not unintelligent. And many of them are in the medical profession. They've seen the evidence. But there is a emotional resonance to the vaccine hesitancy story that engages them in defiance of their own understanding and logic. And to engage that, if you just simply take, as Lisa pointed out, a health promotional attitude of hammering them over the head with the facts, they're going to resist even further. And I think Wynn talked a little bit about that as well. So what's needed isn't just a repetition of what people already know. What's needed is a contrary story that engages them even more. And in this one particular play that I've been working on, we did a production of it in DC at the Mosaic Theater, which is just a few steps from Capitol Hill. And it was called Eureka Day, and it took place in a nursery school in California, private nursery school, where these well-educated parents have convinced themselves that they don't need to vaccinate their children. And then what happens when mumps breaks out? And the character that represented most stridently the anti-vaxxer point of view, in the first act, it was kind of funny, it was a little scary, and in the second act, you actually hear her story. And you empathize with her point of view, not because she's right scientifically, but because you get it. And The arts offer an opportunity to step into somebody else's shoes and see a different perspective, and it allows the opportunity to find that consensus if it exists, and to find that way forward, which may not be the way forward that you had in mind when you entered the room. And I think that's really important, that we can't be so arrogant and convinced of our certitude of what the other person should do that we lose the ability to actually listen to them. And the arts allows us that.
Chris, can you also speak to the question around local context that came to you, which you kind of have, I think, a little bit.
Yeah, I mean, to me, it's always local context in almost every situation. And in fact, in the interest of time, I will refer you to the performance I'm giving tomorrow at 4 o'clock, where I actually go into the actual stories in Africa, in India, in El Salvador, of this in practice in a variety of different healthcare settings, and why things happen the way they do in terms of the science. But I think for here, and for those of you who can't come tomorrow, at the end of the day, you have to go into a situation armed with as much of the evidence as you have, but then let go of it and listen. And there's a power in that. When we go to the DRC in North Kivu, and we're trying to convince people with the evidence to wash their hands to prevent Ebola, and the health workers get attacked for this, we can't just say, oh, what ignorant people. I mean, don't they understand we're trying to save their lives? There's a reason, if we listen, why they're having that reaction. And it's important to find out what that reason is if we're going to be successful.
Thank you. Cathryn, do you want to respond to the question around policy change? Because I know you're generating a lot of evidence. Are you engaging around policy change with the interventions that you have?
Yeah, thank you for the question. So, yes, DMI is very focused on generating evidence that these type of projects and interventions can work. And in doing so, we then try to engage with policymakers, disseminate the evidence amongst policymakers and other practitioners in our field in order to shift policy decisions and funding decisions in a way that recognizes the importance of communication, storytelling, to bring about positive change within global health. So that's something that we are kind of very focused on, and particularly when we have new findings, new results, new evidence, then we will invest effort, time, energy in getting that information to these audiences. And we work with academics such as IPA and JPAL, and they also have got a really strong track record in getting evidence into policy and reaching those policy decision makers.
Okay. Lisa, can you hear us? We can't hear you. Can we turn on Lisa? Is there something I have to do?
Hello?
Yes. I just wanted to give you an opportunity if you wanted to add anything before we wrap up.
Yeah, I just wanted to just continue on with what Christopher Bailey was saying, is that I think that as long as we humanize some of these issues, I think we're going to be able to get farther along. I've done a film on unsafe abortions in Ethiopia with IPAS, and I did a film on male circumcision for HIV prevention with USAID. And in both of those situations, I did get attacked personally for supporting these issues that I believe in. But I think we make headway, and I agree with you, we have to listen to people whose voices are opposing. One of the biggest lessons I learned in making my film about unsafe abortions was interviewing a traditional medicine man who was explaining to me why women chose to go to him versus going to a clinic where Ethiopia decriminalized abortion I think it was in 2008, and why women would still be seeking services from an unsafe provider when safe abortion was accessible and free in a lot of these clinics. And the messages that he shared with me, I think, and what ended up in the film were very valuable for the reproductive health community, because, you know, he said a lot of real things, like, you know, these women sometimes go to these clinics, they have to wait there all day, they're not treated well, there's a lack of privacy, and so if a woman can pay less money to go into either his or he comes into her house, have this private interaction, not having to get scolded or wait in lines or all of that, they may choose that option. And so I thought that was, you know, we shouldn't be also afraid of dissenting voices in some of these issues, because I agree, if we listen, we actually may learn something, we may feel stronger about our position, or we may think about altering, you know, certain policies or customs that we practice on these challenging issues. So I think that's all I would want to say or add.
Thank you. Okay, so I'm getting the signal. Thank you so much to all the panelists. Thank you, Chris, Wynn, Cathryn, Lisa. Let's acknowledge these amazing speakers. And I think they've really set the tone for the next 2 days. Thank you very much. Come on.
Thank you very much, Naisola, for chairing.